Good afternoon, everyone. This is Megan Mahoney, and I'm pleased to be moderating this Family and Community Medicine Grand Round session. This is going to be a very exciting and interesting session. It's on skills for systemic change, the potential of primary care health policy education. And today we'll be discussing the mission and impact of the Primary Care Health Policy Scholars Program. The Primary Care Health Policy Scholars Program aims to support students' development of primary care health policy knowledge, build critical social theory frameworks, and practice the skills needed to create systems change. Through popular education, policy-based praxis, and coalition building with patients, healthcare workers, and policymakers, the program seeks to offer tangible pathways for students to get involved in the politics of health. Medical students are integral to dismantling the current profit-driven and fragmented U.S. healthcare system. Therefore, the program aims to equip future physicians with the community, knowledge, and tools to advocate for robust primary care services and equitable whole person healthcare for all. Collectively, this program, through coalition building, creates greater medical student interest and advocacy in primary care, as well as uplifts student voices, leadership, and passion for social movements for a more just healthcare system. So welcome to all of our panelists and to all of those who have joined us today. I am standing in for Margot Venner, and she provided me with some great reminders that I'm going to share with you all. One is that the session is being recorded. And the second is that there will be an opportunity to enter your own questions. And so please enter your questions and your comments. Those are all welcome. Please look for a recording of the Grand Rounds and any previous Grand Rounds on our website. And I also just want to acknowledge our tech team, Roy, Dorothy, and Arrigo, who have been providing their support today. So I'm going to introduce the speakers, but because we want to dive into the content, I won't be going through their bios, and I encourage everyone to take a look at the website that has their very interesting bios. Today, we are joined by Dr. Kevin Grumbach, who is the founding director of this program. And then also Yushavia Bogan, who is a third-year medical student and the co-creator of this program, the Primary Care Health Policy Scholars Program. We also have Kwiku Jan and Melissa Ma, and also Ananya Somasekar and Zakia Winston and AC Fernandez. Thank you all, and I'll turn it over to Yushavia now.
Thank you. I just want to say thank you first to just everyone in the Family and Community Medicine Department, also to Megan and Margot and Roy as well for inviting us to share more about our work and just for being so supportive of our program. I also want to say thank you to Kevin as well for being my comrade in this endeavor and also just a wonderful mentor to both myself and my fellow scholars. So thank you all. It's an honor to be here with my peers and to highlight the community that we've built in our building. So to get started, what is the Primary Care Health Policy Scholars Program? And I think to kind of get into the nuts and bolts of this, I'll start with sort of the genesis of the program itself. So the idea of this program was generated through a series of combos between Kevin and I. We were discussing our hopes for the future of the healthcare system in the US, how to create systems change, and the ways in which we could support and inspire interest in family medicine as well as primary care. And during these conversations, a couple central themes emerged. The first was sort of that often in medical school and adjacent fields, we are often taught about the social determinants of health and sometimes also taught about the systems that create inequity, but we aren't often given the skills to engage with these systems and organize within our own community. The next was kind of that sometimes with healthcare advocacy, despite sharing similar values with other social movements, healthcare work and advocacy and organizing can be very siloed and separate from these other social movements. Next one was also that the politics and economics of the US healthcare system is extremely confusing, and it was designed that way on purpose. And there is a pretty extensive history of prioritizing profits over people, despite all the amazing love, care, and organizing efforts that many care workers are engaged in. And then finally, which I'm sure you all are familiar with as well, but there's been a decline in students going into primary care and also a national shortage of primary care doctors as well. So I think given that both Kevin and I have backgrounds in teaching and our own motivations towards systems change and organizing, we began thinking about how we could possibly address some of these issues within an academic setting and also create space for students to have discussions about critical consciousness, learning the fundamentals of health policy through primary care lens, sharing resources, and also have a space to just be in community with each other and learn how to organize together. So again, with the support of all the wonderful folks in the family med department, definitely a big shout out to Margot and Roy, and funding from the Primary Care Leadership Academy. Last year, we were able to initially bring in about 9 students together to participate in our collaborative learning program. And then this past year, we were able to grow our program and now have about 16 scholars. So I don't want to go too into detail of what our program entails because I will let my peers speak about their experience, but just want to say thank you again for believing in us and for kind of giving us the opportunity to create this program. And without further ado, I'll let some of the scholars share more about the program.
Great, thanks, Yushavia. My name's Kweku Jan. I'm a fourth-year medical student, currently on a gap year pursuing a Master's of Public Health at UC Berkeley. And I'm going to talk a little bit about kind of the state of primary care right now and why it's of interest to us as medical students. And so just to start out, so in 2020, as of 2022, about 11.5 million Americans or Californians, or about a quarter of the state's population, resided in a primary care shortage area, as you can see in the map on the right. And it really is a large equity issue as well, because Black, Latine, and Native American communities represent about 2/3 of those living in these shortage areas. Next slide, please. And so just a little bit about why primary care matters, obviously sort of preaching to the choir here, but first, primary care saves lives. One study found that just 10 additional primary care clinicians per 100,000 people leads to over 50 extra days of life for that population. It also saves money. So one case study, the state of Rhode Island actually required private insurers to increase investment in primary care, and that led to $88 million of savings in total healthcare expenditures. And then finally, primary care improves equity. So the presence of more primary care physicians in a community was found to decrease racial disparities in referral patterns and increase necessary hospital admissions for Black Americans. Next slide, please. So I'm going to talk a little bit about sort of what I term the devaluation of primary care. So UCSF really has for countless years been reputed as a program that is both strong in specialty care and primary care. And personally, for me, that was a large draw to the institution. And you can kind of see from the US News and World Report screenshots that I have here that it's considered a tier 1 school for primary care. But despite this, most UCSF grads actually select a specialty other than one that would lead to primary care and often don't end up practicing in health professional shortage areas. You can see that we're ranked number 61 in the nation in graduates practicing in primary care and 165 in those who practice in a health professional shortage area. And then from my personal experience as well, there's both sort of subliminal and not so subliminal messaging that really devalue specialties that go into to primary care as well as family medicine as a worthy career path. And just one quick example, on one of my rotations in my third year, one of my preceptors actually said that I was, quote, too smart to go into family medicine. And so comments like this can really dissuade students from pursuing paths that lead to primary care. And then finally, a large percentage of UCSF grads do go into internal medicine, which really once was a common path to go into primary care. But the share of internal medicine residents pursuing a subspecialty now has steadily increased from 61.5% in 2018 to about 88% in 2024. So really, internal medicine is going largely more towards subspecialization and not primary care. Next slide, please. And so, why primary care matters to us as medical students. So, I believe really many of us, if not most medical students, really do enter with a heart for community engagement and advancing social equity and justice. And for those who choose primary care, whether through family medicine, pediatrics, or general internal medicine, many see it as a way to be closest to the communities that they care about, especially those that they identify with. Like for me, the African American community is a community that I'm really invested in. And so there's also a sense that the history of family medicine as a specialty and the spirit of many family med physicians is really aligned with social justice and those goals, which provides a place of belonging really for students within the institution of medicine, which often really hasn't prioritized folks at the margins in the history of the field. And so the Primary Care Health Policy Scholars Program really has uplifted the value of primary care and created a space for like-minded students to learn, bounce ideas off each other, and learn how to invest in whole communities through both policy and advocacy. And I'll pass it to my next colleague.
Thank you, Kweku. So before I begin my section over coalition building and community within the space, I'm going to talk about why I chose to apply to this program. So it couldn't have been any more serendipitous for me. The summer of 2023, I worked at Southeast Health Center around disparities for well child checks between Black children and their peers that attended the same clinic. And I was thinking a lot about systems, policies, and how they affect the day-to-day interactions at the clinic level. Fast forward to early in the fall semester of 2023, there was an email that went out about applying to the program. So attended the intro meeting, and the rest is history. So the main goal that was discussed at that intro meeting was really the goal to equip students with knowledge about how the healthcare system works and the current underfunding of primary care in order to enact change with SB 770. We'll talk more about that Senate bill and future slides and the work we did around it. So really the structure of this group began through attending monthly meetings where we had different teachings and discussions around health policy literacy. From there on, we built on that work and did research and development of our policy brief. Again, we'll talk more about that later. And really started to have different avenues to present our work, either that being internally through having different reading groups and presentations peer-to-peer or externally with larger groups. Next slide, please. So to get a better understanding of our internal coalition and community, I will share more about our space, also share the grounding theoretical frameworks that guide the work we do, and the opportunities for personal growth and professional growth that the primary care health policy scholar space provides. Next slide, please. As medical students at UCSF, we have a curriculum that's enriched with teaching about the social and political determinants of health and inequities. Overall, we learn how social phenomena create not only health disparities, but also the healthcare systems we find ourselves working within. Even with this learning, there's still the sentiment that choosing to go into primary care, a field that, as the California Healthcare Foundation outlines, is essential to advancing health equity, It's often frowned upon by peers, mentors, and faculty that usually have no malintent. As a student early in their medical training, this can be very demoralizing. However, this space has been really wonderful to feel reinvigoration from a cohort of students with similar visions for the future of healthcare, primary care to be specific. As I mentioned earlier, we have monthly sessions, and prior to our November session, we listened to the How We Show Up podcast episode with local family activist Mia Birdsong. This episode was rich with many discussions about the importance of community, and one quote that stood out to me in particular was Audre Lorde's quote, "Without community, there is no liberation, but community must not mean a shedding of our differences, nor the pathetic pretense that these differences do not exist," end quote. So while I'm grateful for all of the similarities between myself and my peers within this space, I'm also very fortunate for the myriad different identities and experiences we bring to the space, as well as the acknowledgement of our intersecting identities. Next slide, please. This slide shows many of the different activists and philosophers that inform the way we create a communal space, the way we organize, and the way we consider how to engage others in our work. First, I'll talk a little bit about Grace Lee Boggs, social activist and philosopher, notable for her work with the Black Power movement, feminism, and environmentalism. Was a big proponent of positive social change coming from people working together. Next, we have Paulo Freire, the book Pedagogy of the Oppressed, and he shares the popular education model. So to simplify his theory, it's that we can all learn from one another, and that collective participation is essential because we are co-creators in learning. This helps to collapse hierarchy, and so in our group, helps to know that there's no one holder of any like superior knowledge, and that we all can learn from each other. Next, I have All About Love by Black feminist scholar Bell Hooks, and she offers visions of love, community, and liberation that reject normative cultures' tendencies of domination and ownership over people. Next, we have How We Show Up. This is by the activist I spoke of earlier, Mia Birdsong. And in it, there's calls to break away from capitalistic metrics of success. So larger calls to connecting to one's humanity and in the process, figuring out how to be a better community member. And then we have Emergent Strategy by Adrienne Marie Brown. And her work really helps to synthesize all of these frameworks and help guide our monthly interactions with each other. And in it, she posits that we're able to co-create the world we want to live in on our day-to-day basis in our daily interactions. Next slide, please. Now, for some of the more explicit ways that the primary care health policy scholars have been impactful for our development as medical students wanting to advance primary care in some capacity either currently or in our future careers. So for the past over a year now, we've had opportunities to collaborate with capital E experts, meaning policy analysts, leaders of NGOs, and patients involved with advocacy work, all while becoming experts in our own right as students. Also, everyone in the group is given the opportunity to practice the peer-led teaching I spoke about earlier in my presentation about healthcare policy through creating presentations and readings for each other, as well as discussions. All of these opportunities contribute to building our leadership skills. Currently, we're in the process of thinking through creating a zine that shares how to read and engage with health policy, really a creative way to engage people over a topic that's really important and vital to all of our lives, yet while acknowledging that it's inaccessible, that is health policy text. Next slide, please. Now we're at a really exciting point in expanding our program so that it's not only at UCSF. And with this, we're thinking about expansion of coalition and expansion of community. Specific details of this expansion will be discussed later, but it's all to say that it's very exciting. But also a time in which we're really having to consider the work that we're doing and how to best capture that essence in words so that others can work toward that shared mission and values. Here you can read our mission statement and some of the values that are important to the work we're doing. For our values, I'll start with radical advocacy. So we know that patients have stories and experiences that often go unlistened to. And we believe that through partnership with patient advocacy groups and community organizations, we can bring their stories directly to the policy table. Student-led programming, so that's our group, our coalition is an example of that, and we want to have that shown across the nation. And then we also have the primary care workforce development. So we believe that we need to engage other healthcare professional students and workers around advocating for robust primary care communities across the US and the world. And so now I'll have AC talk about our policy education.
Thank you so much, Zakia. Hi, everyone. My name is AC Fernandez. I'm a fourth year in the Health Policy Scholars Program. I'll just start by giving a little bit of background as to why I decided to join the group. My background is in case management. I was a case manager and a health insurance navigator for the New York State insurance marketplace before I came to medical school. I was helping folks sign up for Medicaid and other forms of health insurance. It was a lot of on-the-job training, and I was excited to continue learning more about the business of healthcare and how the privatization of U.S. health systems drives disparities once I got to medical school. And I was kind of surprised at the lack of a standard curriculum in place to teach us about those systems, especially given that we're going to work within the healthcare system and be interacting with topics like insurance over the next several decades. So, why is health policy education important, and what role can it play in the education of medical trainees? As I mentioned, most standard curricula across the country in medical school lacks healthcare fundamentals. It leaves many trainees, including myself, who had, worked as a case manager and health insurance navigator for a few years, feeling unprepared to deal with insurance and coverage disparities of our patients. It's not far-fetched then to also state that it makes us more unprepared to advocate for those patients if we don't understand the systems in which we're working and the systems that affect their barriers to care. Next slide, please. So health policy education empowers medical trainees to do two things. Number one, gain fluency in health systems. Basically, the business and corporatization of medicine is incredibly complex. And as a consequence, it's pivotal that we understand the financial and social barriers that drive health disparities experienced by our patients who we care for. This gaining of fluency also empowers us to take action. So through the Health Policy Scholars Program, like Kweku and Zakia already mentioned, we've written policy briefs. We've taught each other about health systems and the disparities driven by insurance inequities. We have advocated for a single-payer primary care service to expand access to all patients across the state. And we've also been able to have the opportunity to collaborate with community partners and other health advocates. All these experiences have been invaluable to our education and really serve to underscore their importance in a standard medical curriculum. And I'll pass it off to another colleague.
Hi, everyone. My name is Melissa, and I'm a second-year medical student here at UCSF. So next, I'm going to be talking about our policy brief, which is the first big project that we worked on together as a group. So just to give some context, our brief was a response to SB 770, which was a bill signed by Governor Gavin Newsom in October of 2023 that called for the implementation of a unified healthcare financing system for all Californians. And so we really saw this passing of SB 770 to be a compelling and exciting opportunity to rebuild primary care in California. And with our brief, we sought to really advocate for change and demonstrate the critical importance of primary care. So I encourage you to access our brief using the QR code on the slide. But our brief consists of three main sections. So first, we discussed why primary care matters, where we summarize some of the research demonstrating the positive impact of robust primary care services. We talked about the current state of primary care in crisis, and we also provided some specific recommendations when developing strategic plans for SB 770 to really center primary care and its revitalization. And in terms of the writing process for this brief, I found it to be a really unique collaborative process that really encouraged equal collaboration and contribution. We all contributed towards writing different parts of the brief, and I found it really exciting to work with a group of peers hoping to initiate such radical change and like much needed healthcare reforms that really centers and values primary care. Next slide, please. So our specific recommendations for SB 770 are outlined here. So the first recommendation that we set forth was to have a mandatory target for primary care investment of 15% of total healthcare expenditures. And what that would look like in practice would be having that additional spending go towards recruiting more primary care clinicians, but also paying for integrative behavioral health professionals, community health workers, and other staff in primary care teams. Second was our recommendation to ensure all Californians are linked to high-quality primary care medical homes to really ensure that all Californians can overcome barriers to establishing and sustaining stable primary care relationships. Our third recommendation was to implement a comprehensive primary care workforce development program to really support training and increase the supply of primary care providers. So what this would look like would be not only just expanding the number of primary care and residency positions, especially in areas with workforce shortages, but also expanding repayment programs for clinicians and specifically recruiting students from rural areas and under-resourced communities for careers in primary care. Next slide, please. And so the impact of this brief I'm going to discuss next. So in terms of dissemination, we've had a lot of really exciting opportunities to disseminate this work. Many of our scholars have presented our brief to a variety of influential groups, such as the Healthy California Now Advocates Roundtable, Primary Care for All Americans, as well as this year's CAFP Advocacy Conference, which had a lot of state government leaders. The response to our brief has generally been really encouraging. And two of our scholars, Kwaku and Zakia, actually gave a copy of our brief to the head of the California agency that's in charge of setting spending benchmarks. And we are really excited to hear that as of October, the state has actually officially instated our recommended 15% spending goal in primary care. So yeah, it's been very exciting to disseminate this work with the goal of really building support and making tangible impacts on state policy in centering primary care. In terms of impacts for us as students, I think that in general, it's really been fulfilling to be part of a like-minded community with shared values and beliefs about primary care being so foundational to our healthcare system. And I know for me personally that this is exactly the kind of group that I was hoping to find when I started medical school. And our work together and our community has just really strengthened my own interest and excitement for primary care as a field that is really invested in social change. And it's also opened up other opportunities for me as well. My work with this group stimulated some of my own summer research that I worked on with Kevin that looked into public perspectives of primary care spending, which found some interesting insights into how the public believes we spend a lot more on primary care than is the actual case. And lastly, impact on us as future primary care physicians. I think that given that so many of us are really interested in careers in primary care, our work with this group has really given us optimism that primary care's value will be better reflected in future policies. and has really increased all of our interest and involvement in health policy, and the desire to contribute towards systemic change as future physicians. Thank you, and I'll pass it on to Ananya.
Thank you, Melissa. Yeah, so my name is Ananya. I am a second year med student, and I will be discussing a little bit about the future of our program. So we're very excited that program expansion is on the very near horizon for our program. We are thrilled that we received a grant from the Healing Works Foundation, and so we're going to be using that grant to support several other medical schools across the country in piloting their own health policy scholars program. And what we're doing now is that we're in discussion with these schools about what it will look like to integrate the program into either their existing infrastructure or what it would look like to create space for the program within their departments and schools. And so we're just discussing details like faculty leads and student interests. And, with the discussions that we've been having with schools and envisioning our goals with program expansion, something that we've been deeply cognizant of and discussing with each other is how and what we're going to do to preserve the character of our program moving forward. So we're in the process of deciding the things that we really want to see in each chapter of the program, sort of our non-negotiables. And these are things that we find very central to our work here. So for example, a factor that is very central to our program is valuing students for their time. And the ways that we show that here at our UCSF chapter is providing stipends to students to acknowledge their effort and all the work that they put into the program and show appreciation. We also have things like good food at each meeting, which is not only really motivating to us as students to show up and work hard, but it addresses issues of food security, which are very relevant to medical students and in the decision-making process for us for, which activities to be a part of apart from class. So we're currently trying to establish what this will look like in other schools. And we're also currently formalizing a curriculum to share with other schools to provide some structure and ground all the chapters in the values and the theory work and the discourse that has been very essential for us. Something that we have in each of our meetings, as Zakia discussed earlier on, is that we have discussions about podcasts or readings that we do before the meeting where we reflect on really integral subjects like social movements that inspire us or the work of advocates and how that applies to the work we're doing here in the program. And in my experience, these discussions have just been integral in not only growing my own knowledge base with the program, but it's also just been a great part of community building and really getting to know my peers and our backgrounds and just the knowledge that we're able to share with each other as peers and having this space where we can question and engage with each other has really been invaluable. So we would like other chapters of the program to also have these discussions, and so we're formalizing a curriculum for that. And I'd also like to shout out that we've been consulting with AFP with the expansion, and we're working with AFP medical student programs. And so now kind of for what we hope to accomplish with the expansion of our program, we sort of similar to what we want to do with the program here at UCSF. We really want to build a coalition of med students across the country who are dedicated to uplifting primary care through policy and support them in doing that by helping them develop the tools to do that. And we want folks to develop tools so that they'll be able to address issues in primary care policy that is unique and necessary to their own context and community. So the hope isn't that there's going to be, different iterations of the policy report that we already did. The hope is that students can create projects that are rooted in what really their local community needs and what would be the most effective for them and takes advantage of windows of opportunity within local or state governments. And something we also believe is that having this coalition of med students across the country can really be a way for all of us across the chapters to provide each other with missing pieces of the puzzle in terms of issues in primary care on a national scale. Each chapter that is going to be coming in is going to be an expert within their own context. And as we know, the state of primary care policy and health policy at large is really different state to state. So we're hoping that by building this coalition, we can also develop a more well-rounded understanding of primary care in this country and use that use that knowledge to be effective change makers. And the last point I want to say, kind of bringing in my own experience with the program and what we hope for it, is that as my peers have previously mentioned, we really want to help create a community for folks who have this interest in primary care and be of support to each other when having an interest in primary care can unfortunately be a little isolating at times in med school. In my experience, I came into med school with a pretty clear understanding that I want to pursue a career in primary care from my previous experiences in public health and advocacy and caseworking. So that first couple of months in med school, I felt a little lost because it wasn't as easy to find a community or a group of students who had similar interests. So when this program came along in the fall, it was really a game changer, and I'm so grateful to have met all the folks in this program, and I really look forward to each meeting, and it has just been such a wonderful experience. So we're hoping that with the expansion, this can also be a case for students across the country. Yeah, and so to close out, I'm going to pass it on to you, Shavia.
So thank you everyone for sharing a bit more about your experience in the program and kind of just like highlighting the ways in which we're building community and slowly building our advocacy skills as well. If anyone who's attending this panel or in the future is interested in participating, you can follow this QR code and fill out the form and get in contact with us. But I just want to reiterate that kind of the core central values of this program is really about radical organizing, radical thought, and kind of centering both community and just like love in a lot of way, both through like interpersonal interactions and then also just trying to build very tangible skills and engage in work. I think one of the biggest things for me about creating this program is one, how do we also get opportunities for students and make sure that this feels like a generative practice for everyone and that there are ways we're helping you build your skills and build your resume, because we do live in a society that requires us to do those things as well. And that's a big part of our career, but making sure there were things that people could really walk away with. And then two, also making sure that we really cared for each other in the process. And those are some of the values that we hope to maintain as we continue program expansion. And a big thing that I always like to speak to is really valuing students' time and labor and dedication. And a big part of our program is also providing student stipends so they feel well taken care of, and meals at every meeting, as well as just like many opportunities to be together and meet patients and kind of practice reciprocity. So thank you all for listening to our talk, and I will turn it over to Megan and Kevin to wrap things up.
Wow, Yushavia, that was incredible. Just kudos to all of you. This was an extraordinary presentation, so well organized, and the work that you're doing is inspiring. It's wonderful to see the impact that you're having already at a state level and seeing the expansion across the country and all the chapters. So just real congratulations. And I'm seeing a lot of love coming from the audience as well. We already have one question, and I will jump into that question. But I also encourage our audience that don't hold back. I know a lot of people want to engage with you, and so we hope to see more questions come in. And then I certainly have one if we have time. So the next question that we have, the first one is, how can this program support high school students and undergraduate students interested in primary care? Are there ways to engage public health students, for example? So we just want more, and we want it to spread beyond the medical students. What are your thoughts?
I can speak to that for now. I think while we were growing this program and just both the nature of our funding, we were mostly focusing on medical students, but we hope to create more like long-lasting programs, as well as expand our program in the future and create opportunities for mentorship. So that's something, if there's someone who's interested in supporting our work, we're very collaborative and want folks to bring in their skills and expertise. So I hope in the future what this program will also incorporate is mentorship development too, as a way.
Fantastic. And that relates actually to my question and the quote that I love from Audre Lorde that Zakia pointed out: without community, there is no liberation. And the effort and intentionality that you have behind creating that community. You talked about the good food, you talked about the stipends, you talked about other ways in which you're building your coalitions. And then you also mentioned the importance of leadership and leadership skills building, the practical side of building that skill set. And I wanted to know, and I have my own response, but I'd love to hear what you have to say. Sometimes when we talk about leadership development among students, people might have a comment that that's too early, that people don't have the experience yet, that really they should focus on medical school training and then wait until they become physicians to learn leadership skills. All of you have had very interesting paths to medicine with a lot of experience under your belt that you're contributing now. But I'm curious about what you have to say to somebody who has concerns that, focusing on leadership and some of these skills is just too early in your medical school trajectory.
Yeah, I can speak to that a little bit. I think that when you say like leadership, that can seem like very daunting and kind of don't know like what that term means sometimes. And I think you think of like, oh, I don't know, like people in suits and like briefcases and like at these conferences and like that's what it means to be a leader. But I think that in this space, there's other ways to think of leadership. Like you could think of leadership as being able to be a good communicator, or just thinking of like Mia Birdsong and her ways to thinking about like how to relate with people, how to get through conflict resolution, how to have empathy and care for people that you're working with. Like I think those are important skills to being a leader. And I think unfortunately we've strayed away from thinking of those skills as being leadership skills. But at the same time, I'm very fortunate that being a part of this group, we are highlighting the importance of that also being skills that make really great leaders. So I don't think it's too early, and I think just um, asking the question back to people of what they think a leader is often can help with that process.
Anybody else have a reaction to that, AC or Nishavia?
I have just a small thing to say. I agree with everything that Zakia mentioned, and yeah, thank you for articulating that. I think as medical students, we're sort of put in this weird position where we're exposed to a lot of disparities and heartbreaking cases in the hospital all the time, and often we feel powerless to advocate for our patients. And one of the reasons I personally have felt powerless is because of sort of not understanding what to do if an undocumented patient comes into the ED, and knowing whether if we admit them, I'm bankrupting them. And those are systems. Those are systems issues that the current curriculum just hasn't empowered us to feel like we've got a hold on. And I am so grateful for this space because, in addition to everything Zakia mentioned, like we have fundamentals now that we can feel more empowered to speak with our attendings and our residents and our case managers and our social workers to help advocate and become leaders or advocates, however you want to call it, for our patients in the system that we're exposed to every day as students. So I don't think it's too early. If it's not too early to expose us to those things, it's not too early to do something about it. So that's all I have to say.
And then just to build on top of what everyone else has said, because I agree and echo those sentiments as well. I think one of our biggest journeys in like the next chapter of like our political landscape and economic landscape is also just decentralizing leadership and really kind of also undoing and unlearning like hierarchy and hierarchical power. So I think everyone brings like incredible lived experience to every situation, and there's so much to learn from each other. And it's so important to like nurture that and really step away from these systems in place that have like, prevent us from really being able to have honest exchange with one another and like work together. So
You're pointing out a really important aspect of this, which is that this is an opportunity early on in your career to have that fresh perspective on what's happening in the system, that perhaps over time, once we have more time in the system, it's harder for us to be a leader in that capacity. So I appreciate those perspectives. And now we have a couple more questions are coming in. One is a comment from Roberto Vargas, who says, "This work is amazing and inspiring. Thanks so much for sharing. You mentioned the challenge of not feeling our current medical education is lacking, and it's a capacity to prepare you for understanding how policy and systems change. I've also heard anecdotally that JAM week doesn't yet offer what students want or need. What skills would you like us to provide more of for students who want to understand how to be advocates for systems change?" Anybody?
I can start us off, but I also want to give time and space to anyone else who wants to speak as well. Anybody? Is that cool? Cool. I think a lot of it is like kind of, I know a lot of us bring interpersonal skills, but kind of just like solidifying them as well, like generous listening as well, kind of doing some of those practices, like what it means to feel seen and heard, and kind of really doing a lot of activities that focus on that. And then I think, again, also just like learning the basics of US policy and politics and like how laws are written, how laws are formed, how economic policies trickle down into our healthcare system. I think they're just like some basics that, we're not taught, not on purpose, throughout like even our high school education and college education, unless you take specific courses, but aren't universally available to everyone. So I think honestly, just some fundamentals would be important. But Kwaku, did I see you unmute for a second?
Yeah, I can speak to it a little as someone who's chosen to do the MPH, and so kind of diving into that a little bit more. When I was in preclinical, it wasn't called JAM, and so maybe there's been some updates, but I think kind of one of the things that I felt would have been helpful is also just a lot more context to where we are. Obviously, San Francisco is different than New York, is different than the South and the Midwest, and I think that the histories of racism and all the isms are important to understand in how healthcare is delivered here. And so I also think the centrality also of like community-based organizations can't be understated, and nonprofits in the area. And so I think curriculum that really points to the resources, not just looking at a deficit-based way of thinking, but what are the kind of attributes that we can tap into, and what are the community networks and the things that have worked as far as uplifting those on the margins, specifically in the SF Bay Area. And then I totally agree. I think I really do think every physician should have a basic understanding of the economics and funding. And we've done a bit of that in this program, is just like, how are things financed? How have we gotten to where we are? Because I think that speaks a lot to what we can do to unravel what I think has been intentionally a warped financing system here. And then, yeah, what are some like basic tools in advocacy and policy, as far as like, what is a bill, what is a law, how do things get into law? And I think especially given that most of our graduates will stay in California and a large amount will stay in the SF Bay Area, like what is the specifics of California? Because in a lot of ways, California really is a leader in the country as far as health policy and initiatives. And I think we didn't quite get the extent of that, and I didn't quite appreciate that as much until embarking on the MPH. And so I'd say like the long and short of it is maybe a little bit more like context specifics, and then the toolkits that Yishavia mentioned as well. But I do think that from what I have heard, there have been strides to move in that direction.
And then there's one thing I want to just add on to what you were saying, Kwaku, and just like the question about JAM. I think like a big part of it is just learning how to critique capitalism as well, and just even naming it and naming the like highly designed systems that have brought us here, and providing not just policy related stuff, but like the kind of rich theory that like so many advocates and activists have really written upon to like critique capitalism, and like learning how to talk about it that way, because it's a systems issue, and it's all generated by design to exploit certain people. So I think really bringing that edge to discussions is important as well.
These are all important aspects. And for those of us who weren't aware of JAM Week, JAM stands for Justice and Advocacy in Medicine. And it's a course that's taught in medical school. So thank you so much. One great question here is, as a former UCSF attending, I'm so proud to hear you all and so inspired. What have you learned about the physician's role in policy currently, and what are your hopes for how we, as physicians, will be involved in policy in the future?
Feel like I'm talking a lot, so I don't want to take away the stage from other folks, but I think just learning how physicians can get involved in like actually writing policy, or like where our research goes after we generate it. Because I know it's like in publications and academic journals, but like how does that actually translate to like different economic approaches or like insurance policies and things like that. So kind of learning both from Kevin and his career, hearing from other like union organizers, and I would say community members and ways they were able to get involved, I think has just been really like important to learning what we can do as physicians. Because I think a big part of like all of us choosing to go both into medicine and become doctors is because there is this element of like power that comes with the career, and it's kind of like, how do you wield it? So it's been very, important to kind of see these examples of folks doing things in the community and then at like national and state levels too.
I think the tricky thing is that medicine traditionally has always been like an apolitical career. Like, I think it's very uncomfortable for a lot of physicians to take stances on policy for fear of it being too political. And that's a whole other that's a whole other game that we can talk about. But one of the things that's been really inspiring, just to use Shavia's point about this, like how do we translate research into action, is through some of my work at the Earth Center for like environmental justice work. I've seen a lot of physicians and researchers sort of seek out opportunities and they've had to do this proactively, because oftentimes the powers that be benefit when like they don't have our expertise. But one of my mentors in the Earth Center, for example, Dr. Tracy Woodruff, goes to Capitol Hill like 2 times a year. And that's like a very big, that's like obviously on a very macro scale, but she sort of has made a point to make sure that she's speaking to congressmen, legislators, and her work is on like toxic substances and that sort of thing. So it's a little bit different. But I think the point is that programs like this sort of help us learn that proaction is needed, because physicians haven't always have traditionally not had a space in the policy arena, and that should change, because we see the disparities and the consequences that are born out of not consulting with physicians and folks who are in the trenches, working within this healthcare system every day.
This is tremendous. And I just wanted to note that a number of leaders have put in some comments, just really being impressed and inspired by this talk. Aisha Queen Johnson, just says, thank you for your inspiring work, and these voices are so needed. And a public health leader in New York, Michael Mendoza, who is in my family medicine residency program class here, mentions the importance of mentorship. And this is something that you all have mentioned as well, and how it's great to be lifting each other up as we go along. I can't believe the time went by so fast. It was such a rich discussion. Thank you all for inspiring us. We are just in awe and so proud of what you're doing. And thank you, Dr. Kevin Grumbach, for your leadership in putting this together. This was incredibly innovative and effective, and so great to see the progress that's being made and the impact to come. And thank you all for joining today. We appreciate you. Take care. Have a great day.